First, the constipation. Constipation is only a problem of the large intestine. Sabi ng author, if I have a patient who suffers with many problems, of which constipation is one, it would be my primary concern to treat it first. If there is no free elimination of stool, it will cause many other stagnations and retention in the rest of the body. Treat the constipation effectively, and many other symptoms will disappear without ever being treated. These are basically two types of constipation. First, we have the large intestine, excess yang, and deficient qi. Stools, once a week or so, patients feels full, heavy, lethargic, but has no urge to go to the toilet. Stools are rather large when they come, not dry except at beginning. There is abdominal distension in the evenings and not much wind. Patient has problem with elimination in general. Tongue is thick, white cord coating. Pulse is soft, slow, and wide. Sa treatment, we use LI4, stomach 25, triple warmer 6, stomach 37, UV 25, LI 11. Excuse. Paravertebral plumb boson tapping from level L2 to level S4 until red skin reaction. Next, LI. Next, our diagram, LI, decrease ang yin, and there is normal yang. Stools daily may be more than once. Patients has often an urge to go to the toilet. Stools very small and dark like a rabbit stools. Not much distension, can pass wind, more so in the morning. Skin is generally dry. Tongue is dry or cracked. Pulse is thin and tense. Sa treatment, we use LI4, stomach 25, triple warmer 6, stomach 37, LI5, lung 9, and kidney 10. Diseases of the metal elements. The following conditions had been covered earlier in the chapter: excessive sweating, common cold, epistaxis, skin types and treatment, yin and yang diarrhea, yin and yang constipation, sadness and depression, claustrophobia, agoraphobia. Acute hay fever. Sa treatment, there are many successful methods for treating acute hay fever. The points I tend to use are, so my local points, this depends on where the patients feel most of their symptoms. First, sa nose and sinuses, extra point, 1, the yin tongue, LI20, UB2, sa throat, SI17. If there's a headache where it hurts, though they tend to hurt around the sinuses, LI4 area distal point, GB20, the most effective point, wind eliminating point for the head and face, especially when given with the appropriate wind elimination technique. Lung 6, sedation, the cleft point, used to sedate an organ in an acute situation with excess of yin or yang. Liver 6 sedation if eyes are itchy and red. C-cleft point and stomach 40 against excessive mucus. Ear acupuncture for the internal nose. We choose the lung, endocrine, triple warmer, and the pharynx. This could be added in this area if this area is affected. Ideally, the treatment should begin with the earliest symptoms in the year and the patient treated daily for 4 sessions. If necessary, 1 or 2 more weekly sessions could be added thereafter. The patient would be at least 50% better during the season. Of course, they must not try to push their luck by lying down and rolling on the grass to check how much better they actually are. If they follow some ground rules, sleeping with closed windows, not putting washing, especially bed linen, out to dry, using a dryer, washing their hair before going to bed if they had been outdoors, they will feel good. The following year, they should be treated with the same way, and this time they can be more adventurous. Treatment should be given for 3 years at the same time of the year, every year, to obtain complete cure. Next is chronic allergic rhinitis, a very common problem among our patients. The cause could be dust mites, pollen, animals, chemicals, cosmetic products, and poor adaptation to climatic changes. It is also a difficult symptom to treat successfully because the protecting energy, which is the Wei Qi, is rather low. Chronic rhinitis is an important cause of frontal headaches in patients, even if they do not complain of rhinitis. Once the rhinitis improves, the headaches also disappears. The treatment, the following local and distal points can be used in every case. LI20, extra point 1, the Taiyang, and GB20. Spleen 10 for allergy, stomach 40 for mucus. In addition to this, we could give some other points to suit the patient's special imbalances. The 5-element diagram below shows the relationship of other organs to the lungs. So the 5-element diagram, there is a decreased heart yin, spleen qi, dampness, the lungs, yin deficiency, dryness, liver yin or blood with ascending wind.